am Rhonda, level 1 nursing student. I'm going to be shadowing you today.
Cool, nice to meet you. My name is Lance. I'm fixing to go to Pixis and get some medication for my client. He's ready for some insulin. Can you follow me?
Sure.
The client I'm taking care of is Lite, and he's due for his insulin, Lispro, 1700, and we're within time for that. So I wanted to pull out his medication. You want to make sure you got the right medication. The right route is subcutaneous, the right patient, Lite. The right time is 1700, and the dose is on the sliding scale. And when we're bedside, we pull up the green light to enter it, and it'll give us the doses we need to give to him. Okay. Let's push this cart to the patient's room. Good evening. How you doing today?
Good, how are you?
I'm okay. Can you tell me your name and your age?
My name is Ronald Jarvis.
I'm Glenn Light, 67 years old.
Cool. Do you have any allergies?
Not that I know of.
No.
Cool. Yep, and it says here, no allergies. We give a bedside report.
Okay.
This is as far as you learned about in level 1. My client is Glenn Light. He's in room 619. He's a male, 67 years old, 171 pounds, 5'11", with no known allergies, and he's a full COVID. He's a stage 2 diabetic, pressure ulcer on his right heel is why he's here today, and he's a type 1 diabetic. He's PERLA, alert and oriented ×4. He has qualitative deficits identifying pinpricks in his bilateral lower extremities. He has upright posture and with a steady gait. His lungs are clear to auscultation in all lobes. His breathing is unlabored without accessory muscle use, and his cranial nerves 2 to 12 are grossly intact. S1 and S2 heart sounds appreciated without murmur, rub, or gallop. He has a regular rate and rhythm with no carotid bruit. His abdomen is flat, symmetrical, soft, with no tenderness. Bowel sounds are present ×4 with no ascites or bruit present. His latest vitals were at 1645. He had a heart rate of 76, 96% O2 saturation with 128/70 blood pressure. His last temperature was at 1550 as 98.4 Fahrenheit. The medications he's on Zocor, Neurontin, NPH regular insulin mix, Humalog, which we're giving him today, and morphine. His last Accu check was at 1645, and he had a 290 glucose, which is high, so we're giving him, he's ready for his insulin. He has an IV on his right median vein. It was implanted at 1645 today. All his lab values are within normal limits, except for his hematocrit's a little low at 41.2, his calcium's a little low at 7.4, and glucose is high at 290. And then the diagnosis for this patient would be impaired skin integrity related to alteration in sensation as evidenced by skin loss of the dermis. And some planned interventions we have for this client is diabetic teaching. He requested some information on his diabetic diet because he hasn't really been following it, and we also want to make sure he knows the signs of hypoglycemia, danger signs. And we use 0.9% normal saline to clean his ulcer and dress it with sterile dressing. So potential complications with this client could be hypoglycemia or infection. You have any questions for me?
I do. Why is the client receiving this medication?
His blood glucose is high. He's in hyperglycemia. He's a type 1 diabetic, so he doesn't produce insulin, and he has to have it administered to him.
Okay. What action does the medication have on the body?
Insulin draws the glucose out of the blood into the skeletal muscle and fat, and it also inhibits the liver from producing glucose.
Okay. When should you question administering this medication?
Normal glucose level is 60 to 100. If he was below 70, I would question giving it because it can send him into hypoglycemia.
Okay. Does the med have a therapeutic level?
There's no therapeutic level for insulin, but like I said, you got to definitely check his glucose levels.
Okay. Which vital signs must be monitored?
You need to monitor his temperature, respiratory rate, his blood pressure, heart rate.
Okay. Which physiological parameters should be monitored when the medication is being administered?
Well, you want to monitor his vital signs every 8 hours, and you want to assess for any allergic reactions at the site of injection.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You want to ensure the client knows the signs of hypoglycemia, so you can let the nursing staff know about it, and that would be tingling in your lips, your hands and feet, chills, nausea.
Okay. What interventions must be taught for the safety for taking the meds safely at home?
The client needs to know insulin needs to be stored and used at room temperature. He needs safe disposal of syringes, to never reuse syringes. Still the signs of hypoglycemia, and if he is aware of signs of hypoglycemia, to check his blood sugar, and to just check his blood sugar daily.
Okay. Are there any side effects of this medication?
It could sense. If someone had an allergy to it, it can cause an allergic reaction, or if too much is given, it could send them into hypoglycemia.
Okay. Are there any adverse reactions? You kind of already answered
Yeah,
that for me.
hypoglycemia.
Okay. How will we know the medication is effective?
If his blood glucose comes back into normal levels between 60 and 100, then we know it's been effective.
Okay. All right. I think that's all my questions I have for now.
Cool. Let's. Okay.
So the green light's on, we have the right.
Can you give me your name and your age, please?
Okay.
I am Glenn Light. My age is 67.
Cool. And do you have any allergies?
Not that I know of.
Good deal. And it says he has no allergies. It's Glenn Light, 67 years old. We have the right patient. Now,
So I'm gonna do the same thing with the second one. Okay.
our scanner's down. What I'm doing, I'm in the MAR, I'm getting ready to administer his medication.
Okay.
And I need to put the patient's ID and the medication barcode in there. Our scanner's not working right now, so if I can get you to read the number off to me.
Okay. 650
650
255
255
5339.
5339. Okay, you get the medication. B, C, 9, 8, E, 8, 3,
Okay, so we see
6, 5, 1. Okay, we're doing our 5 rights. We had the 5 rights being, I got the green light, which means I had the right patient, I had the right medication, the right time, because it shows 1700, which we're within the time frame, and the right dose. The dose is here on a sliding scale. He had a blood glucose of 290, so according to the sliding scale, he's due for 6 units of insulin. Do you have any questions about this medication, Mr. Light?
No, but I wasn't really sure about my diet. I've been kind of falling off the scale there.
I was told about that. I do have some information. Actually, I'll give it to you right now so we don't forget about it. This is some information about your diabetic diet. And I'll be back in after about 30 minutes to an hour after I give you your medication to check your blood glucose to make sure everything's going right. And if you have any questions, you can ask me about it then. Do you know the signs of hypoglycemia?
I know a couple, but what do you want? You could tell me some.
You need to be aware, like if you have any tingling in your lips, in your hands or feet, any nausea or chills, while you're in the hospital, definitely let someone know about that. When you're at home, definitely check your blood sugar to make sure your blood glucose is within normal levels.
Okay. All right. Thanks.
Okay. I wanted to make sure he understood what medication he's getting.
Okay.
Okay, so we got the right medication, the right patient, right dose, right time, and the right route, subcutaneous. Now, if this needed to be mixed somehow, or with some other medication or whatever, I would call the pharmacy to get clarification. But it's a straight up in the vial, so none of that needs to be done. Okay. When was your where was your last injection at?
It was my left side of my abdomen.
Okay, is there any problem with me getting on the right side of your abdomen today?
No, I'm supposed to rotate those, right?
Yes, definitely do. Okay. Definitely want to clean the top of this.
Okay.
Patient safety is paramount. And I'm going to draw 6 units of air into it to compensate for the displacement of air pressure. And I'm going to draw 6 units out, ensuring there's no air bubbles.
Before you go,
You always want to use the one-handed recap method because nurse safety is also paramount.
Okay.
Now you always want to do a double check with another nurse. You want to verify the drug and the dose
Okay.
matched what the MAR says.
Yep.
Okay, good. Okay, so one last time we're going to ensure we got the right drug, Lispro, the right dose, 6 units, the right patient. Can you tell me your name?
I'm Glenn Light,
How old are you?
67.
We got the right patient. The right time is 1700. We're within time. The right route is subcutaneous. And you said we're doing it on your right side, abdomen?
Yeah, that's good.
Okay.
wash
Wash.
napkin.
Sterilize it
While
for
I'm
15
documenting
seconds.
right now, so if you have any questions, just let me know, okay? Okay, and so when I document, I just want to make sure that I put
When was your last
the,
meal?
you know, the
It was a couple hours ago. I'm getting hungry.
Okay, yeah, your meal is about to come in because with this medication, you want to give it immediately before or immediately after because it's very fast-acting insulin.
Okay.
I'm letting it dry a little bit because you don't want to go right on with alcohol.
Okay.
Subcutaneous injection, 90 degrees. Immediate discharge container. We'll get you covered back up.
Thank you.
Okay, so were there any pertinent pieces of information
I want to document.
yes, I will review the patient blood results as well as the injection.
I want to document that
Okay, did this information affect the decision?
time I gave it.
Yes, I want to know the patient current blood pressure level so I can adjust.
1715.
Okay, and did this information affect how you administer the medication?
Yes, I want to rotate this out on
The route,
the side
abdomen,
because I don't want
subcutaneous.
any swelling.
I don't know. The location in the abdomen.
Okay, I think that's all my questions.
Okay,
Right
so
side.
you ready to go to see the next patient?
And with my initials. And then save it.
Okay.
Okay. How are you feeling?
I feel pretty good.
Okay, well I got your meal right here and you can go ahead and eat it. I have your call light.
I think
If there's
I did.
if there's anything you need from me, definitely use the call light. But do you remember the signs of hypoglycemia that I told you about earlier?
Yeah, you mentioned chills and nausea, and if I have any tingling in my mouth or fingers,
And what are you going to do if that happens?
I'll press my call light and have you come check on me.
I'm going to be back in about 30 minutes because that's the peak time of your insulin. But go ahead and eat and enjoy and relax, and we'll see you in about half an hour, okay?
All right, thank you.
I have a few more questions
Sure.
for you. Were there any pertinent pieces of information you reviewed before administering the medication?
His blood glucose, it was high, so he needed his insulin.
Okay. Did this information affect your decision to administer the medication?
Yeah, he was due for it, he needed it. He was definitely hyperglycemic.
Okay. Did this information affect how you administer the medication?
No, this doctor ordered, the sliding scale measured the dose, subcutaneous, so it didn't affect how I administered it.
Okay. Thank you very much.
Thank you.
Mhm.